Yes, thank you so much for inviting us to speak here at the CME, and thank you to Anne for joining me for an interview before I start my presentation. I always, in my opinion, it's always super important to hear the voice of the people that we're speaking about, so I think it's really valuable that we can hear your perspective. So I've prepared some questions, and I'm going to ask them in English. I think it's easiest if you also answer in English and then it's translated, right? Yeah. Okay, so Anne, you are a trans woman, and in your words, how would you describe the term gender dysphoria?
Yeah. So gender dysphoria for me personally, I'll speak in two parts then. For me personally, like gender dysphoria is the feeling where you were born in the wrong body. For example, if your brain is female, but you live in a male body. So that's how it feels like. So imagine if you are a doctor, right? You were born male with all the male body parts, but then one day your body completely changes. You have womanly chest, you have womanly figure, womanly curves, everything, and everybody keeps misgendering you as a female. That would frustrate you a lot, but imagine living with that condition for the rest of your life. Everybody socially treats you differently. You yourself don't feel like yourself. You're supposed to be this strong man figure person, but you're not. So that's what gender dysphoria feels like. It's the feeling of going crazy, being born in the wrong body, and everybody keeps treating you like you're the wrong person than what your mind envisions. Also receiving like constant death threats. So both socially and personally, it's gender dysphoria for me. It's basically an inescapable hell. Yeah.
So on the one hand, there's the feeling about your own body and your own physical attributes that where you feel like it doesn't match, which is difficult to deal with. And then on the other hand, you also have the surroundings, so how the society treats you. Maybe you can elaborate a bit more on what your experience is living as a trans woman.
My experience personally, I cannot say the same for all trans people, but for me, my biggest dream in life is to have normal people problems. I wish to have your normal stress, your normal everyday lives, things just going on, like you worry about money and finances, but no. For me, one day when I wake up, any day when I wake up, the first thing that I feel is I hate my hands. They're big and strong. I hate it. I look at my body, and if all I see is disgust, all I see is unnecessary stress and unnecessary struggles that I have to deal with. Then I have to go out, put on false eyelashes to conform to the normal societal expectations of what a female should look like. And there's also, even if I look apart, then there's my voice. I have a really low voice. Actually, I just changed it so that it matches more societally. It's more acceptable for me to look this way. Outside, when I go outside, I already feel like really bad about myself. And when I see other people, I could see judgment. I could see you scanning up and down towards me. I can see that you already have a preconception of me, although you have no information on me as a person. That continues into job interviews, that continues into social relations with strangers, with elevator rides, with traffic, with every aspect of your life. It's like living under a constant microscope of judgment. And that could also affect me financially. So it's not just a matter of feelings, it's also a matter of livelihood. So that's what it feels like for me socially.
Thank you. What types of medical support can you currently access, or also what types of maybe social support structures are there in place at the moment?
In my experience, at least, well, to my knowledge, there is no infrastructure in place to support people like me at all. There's no mental health, that's what you do, right? Mental health stuff for trans people. There's no legit mental health care in Vietnam. There's only notions and I don't know, like there's nothing for me to grasp. There's nothing for me to speak of because there's no mental health care. There's no LGBT care. We don't exist to you guys because we are a minority of the population. So for me to seek out help is, of course I need help. I just want your problems. I just want to deal with normal people problems. But even right now, as I'm speaking, I'm pretty sure I'm experiencing the same thing. Like you would see me as an alien, as somebody special, worthy of speaking right here, but really I'm not. I'm just a normal person. When I go out to seek help, there is none. So I hope in speaking today, could be a small step towards that.
In the future, what structures would you think would be helpful, or what would you wish for? What types of structures, socially, but also legally, medically, would be needed?
I hope there would be at least a societal recognition of trans people and LGBT people in general, but especially trans people, because we are we and maybe intersex people are the most invisible and vulnerable people in the LGBT community since we face with dysphoria. That's what we've been talking about. And I hope to have it known to the public that we exist. I hope to be known towards medical professionals that dysphoria is not just a mental health thing, it also affects our livelihoods and everything, and it should be treated with methods of alleviation. I don't know, I don't think dysphoria will ever go away, but let's just start with question. Let's just start with recognition from the medical professionals that trans people exist. We're not insane, we're normal people. And then provide help with healthcare with what? Transitioning. I think that works. That's a good first step, right?
Okay. And in the healthcare system, what would be a good entrance point? What do you think? So would it be special counseling services, or what do you think would be a good first step to enter into the healthcare system, to get support and get help?
For me, I think the first good step would to be having somebody to talk to. Rather, right now I'm only talking to you because you're, I don't mean this in a bad way, but you come from abroad. So you come from another country, that you know what's going on. It's so hard to explain to medical professionals the type of treatment and like procedures that I need when, if I go into this hospital, there's nobody for me to speak to. And it's a condition that's recognized worldwide yet, and somehow in Vietnam, I think it's still deemed semi-legal or even illegal to even speak of. So a first good entry point would be having advisors to help me somehow alleviate the symptoms that I have to, keep on surviving.
And now you have the possibility with medical students, but also medical professionals sitting here in the room and also joining online to hear your voice. What message would you like to tell them? What would you like to say to them?
I would like to say to them, hello. I would like to say hello. I'm a normal person. I do music. My name is An. I do music production. I am a very competent musician. I could do my job really well. Like you could do your jobs very well. I'm sure you are all great doctors and professionals. I wish to say hello to you as a way of saying, like, I exist, I'm a normal human being, and I hope me and other trans people and people in the LGBT community could be also treated as such, normal human beings. And for people with dysphoria or body dysmorphia, I would just wish that we could speak to you guys more, to say how we feel like a normal patient, which types of treatments should we undergo, and where to find medicine, where to find help, where to find anything. Because I'm pretty sure a lot of people are trans, a lot of people are part of the LGBT community, but they just hide it really, really well, because if we go out to you guys, we couldn't say hello, we couldn't meet each other. What else could we say to one another when you guys don't know that we exist? And that society think that we're insane people, right? For me, I'm not insane. For me, I'm not anything special. And for me, I really don't have anything special to be sitting here and talking to you. I'm just a normal person on the street. And I would love to be treated as such. And towards medical professionals, I would really love for you guys to help me disguise myself better, so that my brain fits my body, so that I don't receive judgment from myself, and I don't receive judgment from society. That also hinders my livelihood. So yeah, hello.
Thank you very much. I think it's really important that you speak here, and that we have room in the CME for your voice. So thank you very much.
Thank you.
Any final words from your side?
Good luck.
Thank you. Okay. Okay. Then, yes, I will continue after this interview with Ann with my presentation. And I think this was a perfect introduction into the topic of psychological aspects of youth with gender dysphoria. I'm going to give you first a quick overview over my agenda, so you know what I will be talking about. But first of all, let me quickly introduce myself. My name is Solveig. I am a doctor working in the Department of Psychiatry and Neurosciences at the Charité University Hospital in Berlin, in Germany. And I'm here as part of a hospital partnerships program funded by the German government together with my colleague Sebastian, between our department and the Department of Sexual Medicine here at Hanoi Medical University. So it's a really great honor to be here and to be able to speak. Now to my agenda, I'm going to start talking first about some definitions and some terms that are important to understand the topic. Then I will be talking about different treatment options, just so we all are on the same ground and have the same basis. Then on the mental health burden. Fourthly, specific challenges and complications. Afterwards, the situation in Germany, so you get an idea of what perspective I'm speaking from, and my recommendations and conclusions. And then in the end of my presentation, I will just zoom out a bit to give you a more bigger picture on the topic of mental health in health in general. So the first topic, definition. First of all, I want to talk about what is gender identity. Or actually my first slide is what is gender identity not? Because there are a lot of confusions between the different terms and what actually gender identity is. So one important thing is that gender identity is not sexual orientation. So these are two different things. Sexual orientation is what I feel attracted to what other type of person I feel sexual attraction to, perhaps also to what gender I feel attraction to, but it's not the same thing as gender identity. It's also not the same thing as gender expression. So the way we dress, the way we act, the way we comport ourselves is not the same thing as the gender identity. And I can also express, for example, male characteristics, even though my gender identity is female. And what's also important to differentiate from gender identity is intersex. And intersex refers to the term or the group of people that experience disorders, or a more neutral term, differences of sexual development. So this refers to those who are born with bodies that vary from both male and female bioanatomies. So this can be due to differences in chromosomes or the genitals or other sexual secondary characteristics. So this is also not the same thing as gender identity. Now, we've talked about what gender identity is not. What is it then? It is a person's inner sense of being. So this can be either girl, woman, boy, man. It could be a combination of both, or also neither. So it could also be the identity of not having any gender at all. So one part of the gender identity is, so we all have some sort of gender identity, and there's a subpopulation that experiences gender incongruence, or where the term transgender fits. And this is a person where the sex that was assigned at birth, which is usually assessed by looking at genitalia in infants, does not align with their gender identity. And then another subpopulation is the population that experiences gender dysphoria. So I think this is really important to note that transgender or gender incongruence, so the gender that was assigned at birth is not, or the sex assigned at birth is not identical to the gender identity, is not the same thing as gender dysphoria. So gender dysphoria refers to the clinically significant distress or impairment that results from the incongruence, the gender incongruence. So this kind of puts the clinical aspect into it. Now, I would like to give you a quick overview of what different terms are used to describe this population. So there's this website where you can look at the different, it's called gendercensus.com, actually quite interesting. You can have a look at what identity words are being used. This has been tracked since 2015. And the top term is non-binary, as you can see in blue. But also queer is an often used term, but you can see that there are quite a number of different terms used. Transgender is one of them, genderqueer, or gender fluid. So I think this is important to just be aware of the fact that there can be various different terms. Now onward to the diagnostic criteria in the different classification systems. I'm going to start with the DSM-5, so the Diagnostic and Statistical Manual of Mental Disorders. And their definition of gender dysphoria in adolescents and adults. So as you can see here, this is the marked incongruence between one's experienced or expressed gender and the assigned gender at birth, which lasts at least 6 months, and at least 2 of the following criteria need to be met. So on the one hand, there's this felt incongruence between the identity and the sex characteristics. There's a desire for bodily changes. There's a desire to live as and be treated as a member of another gender. And there's the conviction that one has certain psychological and behavioral characteristics that are associated with another gender. And what's also very important is, again, as I said before, this condition needs to be associated with clinically significant distress or impairment. So there has to be some sort of burden felt by or impairment of life quality of life in the affected person. In the ICD-11, so this is the International Classification of Diseases, which we also commonly use in Germany. Gender dysphoria is now defined under conditions related to sexual health. I've brought you also the ICD-10 definition. So this was in the previous classification system, but this is the one that is now being used or now being introduced. And here it's defined as it is a marked and persistent incongruence between an individual's experienced gender and the assigned sex, which often leads to a desire to transition in order to live and to be accepted as a person of the experienced gender. So this can be through hormonal treatment or through surgery. And it cannot be assigned prior to the onset of puberty. So I think it's very important to point out this difference between ICD-10 and ICD-11, because in ICD-10, gender dysphoria was actually diagnosed or classified under mental disorders, and the term used was transsexualism. So the definition was then when a person does not feel that they belong to their physical gender or they feel that they are in the wrong body. And this can apply to, for example, female body and the feeling of being male, or in a male body and the identity being female, or also including persons that don't feel like they belong to either gender. But what's really important is that here it's under mental disorders, and in the newer version it's under conditions related to sexual health, making sure that this is less stigmatizing and not saying that gender dysphoria is a mental health condition in itself. I want to just quickly go over a couple of other terms that are important when discussing this topic. What is cisgender? This is a term that describes a person whose gender identity aligns in a traditional sense to their sex assigned at birth. The term gender diverse is just an umbrella term that describes individuals with gender identities and expressions of people that have multiple genders or also no gender at all. It's also something that I mentioned already in one of the previous slides. And then non-binary is also an important term which defines those who have a gender identity which is neither clearly female nor male. Then we have this term sex or gender assigned at birth. I think this is a really important term, so we get more precise in our definitions. So when we talk about the kind of biological gender or sex, we can say in females at birth they are assigned female at birth, and assigned male at birth for those who are assigned male when they're born. But this kind of takes out the judgment over what the current or any assumptions that can be done on the current gender identity. Yes. Now moving on to the epidemiology. This is one study. I think you've already seen it in one of the slides of the presentations on Friday from the colleague from Thailand. I think, this shows the prevalence of transgender people around the world, and you can see prevalence rates or estimates vary between 0.5 and 1.3%. And if you then think about a global population that is older than 15 or 15 and older, of about 5.1 billion people, we have actually very substantial community of transgender people worldwide, around 25 million. And this probably is still an underreported number. What's also important is that this can also be shown in children and adolescents, and they have even higher prevalence rates, so between 2.5 and 8.4%. And what is important to note is that transgender identity commonly develops during adolescence or puberty, so when first signs of secondary sex characteristics, for example, breast development, starts during puberty. Okay, now to my second point, the treatment options. What I really want to highlight here is that there are different treatment options or different options also to support transgender people, and this goes beyond medical treatment. So one very important point is social affirmation. So yes, I think all of these, all of the treatment options or support options fall under the term affirmation, because this shows just that the identity of the person is affirmed. So this can be either done socially by adopting pronouns or names and various aspects of gender expression that actually match the gender identity. Then we have legal affirmation. So this is all of the legal framework. How is it possible? And if yes, how difficult is it to change legally name and gender in identification, government identification documents? The next point is the medical affirmation, and I'm going to look at that in a bit more detail in my next slide. So this can be, for example, hormonal treatment through pubertal suppression, but also giving hormones of the opposite sex, such as estrogen or testosterone, and this can also include surgeries. And one more aspect, which I think is also quite important, is the psychological affirmation, which can be internally, but also externally, so that there's an internal or felt recognition of their own gender. So this is kind of the opposite of internalized transphobia. So, moving on to the next point, I just want to give a brief overview over the different gender-affirming medical interventions, but here really I'm not an expert as a doctor working in psychiatry. You guys are a lot more experienced in this, but I just want to give a brief overview. As I said before, pubertal suppression can be done by hormones that suppress the natal hormones, such as GnRH analoga or agonists. But this is usually then done in adolescents that show first signs of puberty. So the criteria is for the pubertal suppression that they need to be at least Tanner stage 2. And then there is also the other option, or the next step, to give gender-affirming hormone therapy. So for transgender women, this would be feminizing hormones in form, for example, of estrogen tablets or transdermal patches. And for transgender men, testosterone therapy as a transdermal gel or in injectable preparations. Then there is the topic of gender-affirming surgery. These can vary, so there can be a lot of different types of gender-affirming surgery. In transgender men, this can, for example, be the mastectomy, so the removal of the breasts, or, for example, a phalloplasty. And in transgender women, this can be breast reconstruction surgery, or, for example, facial feminization surgery, and different types of genital surgery. What I think is important, so in the international guidelines, we have different criteria for surgery between adolescents and adults. In adolescents, it's a bit more strict, so there's the recommendation of having at least 12 or more months of gender-affirming hormone therapy. But there's the caveat that, or the exception that when hormone therapy is not desired or contraindicated, then the surgery can also be done without these 12 months. And in adults, they just need to be stable on their gender-affirming hormone therapy. And usually this is recommended because the cosmetic outcomes of the surgery improve under a longer-term hormone therapy. For example, it improves the outcomes of breast reconstruction surgery. Now to the topic where my expertise comes in is the mental health burden. What is important to note is that transgender adults, this has been shown in several studies, show more mental health concerns than the general population, but this focuses mainly on affective and depressive, so affective disorders and anxiety, so depression and anxiety mainly. Actually, depression rates can be up to 4 times as high as in the general population. And prevalence rates of mental disorders vary between 40 and about 70% with a lifetime diagnosis. So this is definitely more than in the general population. But what I also think is really important to note is that mental health conditions such as schizophrenia, bipolar disorder, or access to diagnosis, so these are personality disorders or intellectual development disorders, actually are comparable to the general population. Now to the topic of suicidal ideation and suicide attempts. Adolescents with gender dysphoria show more suicidal ideation, more life-threatening behavior, more self-injuries, and also thoughts of self-injuries than the cisgender peers. And in the general transgender population worldwide, there is a prevalence of 29% of suicide attempts in the lifetime, and actually half of the transgender population experiences suicidal thoughts during their lifetime. What's important to note is that half of those who experience suicidal thoughts actually also commit suicide. So this is was published in quite a recent study. And now to compare it to the general population, there's really a marked and big difference. So in the general population, around 5 to 14% think about suicide, and only 1 to 8% actually commit suicide in the general population. So this is a really big concern. What factors influence the mental health of the transgender population? There are several factors and also quite interlinked factors. I think in the interview with Anne, you've heard some of these factors already that can harm mental health in the transgender population. So one big issue is the access to care, which can be due to poorly trained medical staff, not actually, or if the staff, maybe not even like just the training of the medical staff, but that the services are not available. But also the access to care can be impaired through financial burdens, because oftentimes it's not legally provided that the insurance companies take over the money, take over paying for affirming therapy. So this leads to financial stress. If we then look at the other factors, we have just the whole topic of rejection from society, family, and surrounding people, but this can then also be due to, for example, not only in the family and in the peers, but also in the workplace. So this can lead to transgender populations not being able to work in the jobs that they would like to work in, leading them to be marginalized and having to work in more risky work settings, and also actually putting them at a greater risk, not only because of the work-related factors, but just generally a greater risk of violence or victimization. And this can have a lot of different types of violence. So this can be physical, it can be sexual, but it can also be psychological or emotional. So this is very, very important. Then also substance use can be increased in this population. So all of these factors, they play an important role in the mental health of the transgender population, but are also interlinked. And this is what I want to show you on the next slide. This is something that was published 2016, which I think is really a great overview, or a very insightful overview of the different factors influencing health in the transgender population. So at the beginning, you can see there's stigma. Stigma due to the transgender identity, which then leads to discrimination, violence, and direct harassment and abuse, to the fact that and then this leading to them being marginalized in different dimensions. So it can be marginalization in the social dimension, it can be marginalization in the economic dimension, or also in the legal dimension. This then can lead to poor social or emotional well-being, and also more risky situations and behaviors, which is also increased by poor health services, poor health access, or poor access to health services, and a poor uptake of health services, because the discrimination can also be is also prevalent in the health services. The risky situations and behaviors can lead to can have other, I guess, like side effects, such as poverty. It can lead to, because of the economic marginalization, can lead, for example, to sex work and the contraction of sexually transmitted infections, such as HIV. And this in itself, again, reinforces the stigma, just restarting the vicious cycle. So all of this can lead to sickness, and then to an increased mortality of this population. What I also wanted to show you is that there is a website, which is transrespect.org. You can see it down in the right-hand side, which monitors murders of transgender people. So this really shows that transgender people are a direct target of violence and threat. And as you can see, this is also probably quite underreported, but between 2008, when this was started, and 2022, there have been over 4,000 reported murders. And as you can see, this is a worldwide problem and phenomenon. So this poses the question, what can we do to improve mental health outcomes? all of these different things can improve mental health. So all of these have been studied. This is evidence-based, what can improve mental health. So this can be the social transition, it can be legal affirmation, so having laws in place that allow for transgender people to change their names or change their gender in their identification documents. Support from family and friends has also been shown to improve mental health outcomes, reduce suicidal thoughts or suicide attempts. Medical affirmation as well. And of course, access to care is at the basis of all. To be able to access not only the the affirming treatment, but also psychological support is really important. I have brought a study with me, which was done in 2015 with over 20,000 transgender adults from 50 US states that were included, where you can see different, so the impact of gender affirming surgery, on different mental health symptoms and risk-taking behaviors. So as you can see down here, in light green you can see those who have received gender affirming surgery, and in dark green you can see those who have not received any gender affirming surgery. And here on the left-hand side, you can see the different symptoms, for example. So you have severe psychological distress in the last month. You have suicide attempts or suicidal ideation, but also risk-taking behaviors like binge alcohol use or smoking. And as you can see, in all of the population, so in all of the different dimensions that had been looked at, the prevalence is, or the frequency is less in those that have received gender affirming surgery than those who have not received gender affirming surgery. So you can see this directly impacts psychological distress and directly impacts suicide thoughts and suicide attempts. So this is, I think, really important to note. Here on the right-hand side, you can see the different gender affirming surgeries that can be done or that are done or wished for in the population. And here in dark green, you can see this is the population that desired a surgical intervention, a gender affirming surgical intervention, and those in light green are those that actually had surgery done. As you can see, there's a large, so these are the different types. So on the one hand, you can see what are the surgeries that are desired. So for transgender females, a vaginoplasty or an orchidectomy are the most desired surgeries. And in transgender males, chest surgery and hysterectomy are the most desired surgeries. But what I think is even more important is the large difference between the actually done surgeries in light green and those that desired a surgery but haven't had one. So I think this is really important, especially taking into account what impact this can have on the mental health and the risk-taking behaviors. So yeah, I think this is a very important study. Now, when we're talking about mental health and the transgender population, you've seen there's a higher prevalence of depression and anxiety, and there's also a higher prevalence of suicidal thoughts and suicide attempts in the transgender population. But does that mean that the transgender population is mentally disordered? As I showed you before, we had the slide on the stigma sickness slope, and I think there's a lot of good arguments to be made why actually the root cause of the mental health problems is lies in the stigma and the discrimination and marginalization of transgender populations. But this is also, I think, a very important study to underline the fact even more that the mental health conditions or the mental health conditions that are present in the transgender population are not inevitable. So we had a study on the mental health and self-worth in socially transitioned transgender youth and how the mental health outcomes are of transgender children that are supported in their gender identity. So this is from Durwood and Olson, who published 2 studies in 2016 and 2017, and they actually showed that socially transitioned transgender children who are supported in their gender identity by their families have normative levels of depression and only minimal elevations in anxiety. So this actually really suggests evidence-based that the psychopathology is not inevitable within this group, and it's actually a result of what the population is experiencing from their surroundings. Now, one slide to what is the role of the mental health professional when in being in touch with the transgender population. So one important role is to facilitate the diagnosis of gender dysphoria and to explore this, to be open for this, and to also assess for psychiatric comorbidities. So this is suicidal ideation, suicide attempts, but also depression and anxiety are an issue in the transgender population, so it's important to assess for these comorbidities. It's also important to explore if there's a readiness or a wish for gender-confirming medical interventions. And what's really important, in my opinion, is also to support the trans person through the health pathway. Now, to my next topic, what are challenges and complications? I'm going to show you some sneak peeks of different discussions, current scientific discussions that are being had, and current, I guess, more legal discussions that are being had, and what are certain challenges. So these are also somewhat unrelated the one to the other, but I think it's important that you've all just heard about them. So one big challenge is the research challenge. So there's a lack of population data, population level data to monitor the health of transgender people. To make an argument also for policy change and for training medical professionals and for improving health services for transgender persons, it's really important to have evidence. It's important to have scientific evidence, what is helpful and what the current status is. But the studies, the current way of asking also about gender identity does not really include transgender population. So it doesn't, and it also the studies that we are looking at now don't really look at the range of transgender people and the range of different gender identities that can be there. So there's actually a suggested approach how in scientific studies sex or gender identity should be assessed. At this moment right now, there's a question usually, what is your sex or what is your gender, male, female? Sometimes there's also the option to say none at all or non-binary, but the two-step assessment actually is a much more, I guess, what's the right word for it? It's a more correct way to assess it by first asking what the assigned gender, the assigned sex at birth was or is, and what the current gender identity is. So this would include a much more precise analysis of the gender identity in research settings. Now, the next topic is the topic of conversion therapy. So maybe some of you have heard about this. These conversion therapy actually is a therapy that can include, for example, psychological interventions that attempt to change one's gender identity from transgender to cisgender. So there's efforts from, for example, health professionals that try to persuade transgender people that they are not actually transgender but cisgender. This can be done by different people, so by mental health professionals, but this can also be done by religious advisors, clergy, and so on. This can have different types of techniques, I guess. So, for example, talk therapy, hypnosis, biofeedback, but also aversive conditioning. For example, electroshock therapy or induced nausea and vomiting. This is really, so according to international standards and treatment guidelines, this is really not advised and actually impairs the mental health and the health of transgender population. Here on the right-hand side, this is a study which was published by Turbin in 2020, and it shows in dark green those who had received psychotherapy but without conversion efforts, and those in light green and in the middle green that had been subject to conversion efforts in the therapy, and those in very light green, they actually have received conversion therapy under the age of 10. So they were very young when they were kind of tried to convince that their gender identity is wrong. And here again, you can see on the left-hand side mental health symptoms, I guess. So on the one hand, just general psychological distress in the previous month, but also suicidal ideation, suicide attempts, and also suicide attempts requiring hospitalization in the previous months. Then you can see down here also risk-taking behaviors such as illicit drugs, use of illicit drugs, cigarette use, and binge drinking. And in almost all of the categories, apart from the binge drinking, you can see that all of these, so the mental health symptoms and the suicidal ideation and suicide attempts all increase within the population, or are more prevalent in the population that has received conversion efforts, and even more marked in the population that has received this at a very young age. So this is really something that is very harmful and should not be done. One more topic of discussion is currently the diagnosis of gender incongruence of childhood in the current ICD-11, so in the diagnostic system. And there's a debate ongoing about this diagnosis. So it's similar to the diagnosis in adolescents and adults. So there's an incongruence between the experienced and expressed gender and the assigned sex, but in pre-pubertal children. And this can then go hand in hand with a strong desire to be a different gender than the assigned sex, a strong dislike of their sexual anatomy, or the anticipated secondary sex characteristic development, and so on. So this also has to be persistent for about 2 years. This is the current diagnosis in the ICD-11. But now the debate is there actually truly a need for a diagnosis in children? So what I had told you before on the slide of the hormone, the gender-affirming hormone therapy, or also the pubertal suppression, these are all things that cannot be done or should not be done in pre-pubertal children. So at least the adolescents have to show signs of puberty at least Tanner stage 2. So this diagnosis does not actually lead to any therapeutical consequences. So the discussion is, does this not then lead to an unnecessary pathologization, and poses the question, should not children just be able to explore their gender identity and gender expression freely without being labeled when they're still in a pre-pubertal age? Because this doesn't have any therapeutical consequences. So these were some snapshots of current discussions on the topic of mental health and gender dysphoria. And one big challenge that I'd like to point out more in detail is the access to care. So there are difficulties and challenges in accessing care, not only for the gender-affirming hormone therapy, but also, or the surgical interventions, but also assessing mental health support for a transgender population, because also in the medical professionals, oftentimes there's a large stigma involved when dealing with transgender people. So this is a big issue. And the second point actually just points out once again that there's a lack, on the one hand the discrimination against transgender people, but also a lack of skills. Oftentimes from the transgender population, providers are seen as unsupportive or hostile, and this can then lead to parallel structures developing. So parallel providers who can then engage in treating transgender people, for example, offering hormone therapy or offering surgeries, but they are medically unqualified. They have substandard equipment and materials, which puts the transgender population at risk. And on the other hand, it can also encourage the usage of self-administered hormone treatment, which is the big risk being that this is unmonitored and can have side effects. So this is really one of the big issues when we're thinking about access to care and what the risks are that go hand in hand with a lack of access to care. Now, I would like to give you an overview of the legal situation in Germany and what our legal background is. Here are just some laws that are important for describing the current legal situation for transgender people in Germany. Since October of 2017, marriage for all is allowed, so independent of gender identity and sexual orientation, marriage for all is possible since October 2017. There's also a general equal treatment law, in German Allgemeines Gleichbehandlungsgesetz, which criminalizes discrimination against people due to gender and sexual orientation at the workplace and in private. So I think this is something that's also really important to have in place, just to have a legal basis where people can actually go to court if they experience discrimination at the workplace or in private. Also, there was a change in the civil status law in January of 2019. So now there's the possibility to have 3 different gender entries. So this can be female, male, and diverse. And there's also the possibility to document no gender. Now, I want to give you an overview over what current conditions are in place for people to change their gender entry and their first name legally in Germany. This is actually a very quite outdated law dating from September 1980, so it's more than 40 years old, and this is also reflected in the different paragraphs included in this law, and also I think reflected in the name of the law, because it's the Transsexuellengesetz or transsexual law. And if we're now looking at current standards of research, we don't refer to people that are transgender as transsexuals, because gender and sex are 2 different entities, and this is actually not the quite correct saying. So this transsexual law from 1980, which is currently still in force in Germany, defines the conditions under which trans people are allowed to change their name, their first name, or their gender entry. And for this, there's actually the need for a court ruling. And for this court ruling, there is the need for 2 opinions from professionals. And these professionals are supposed to be sufficiently familiar with special problems of transsexualism. So this is what is noted in this law, in this paragraph, and must confirm that actually this person really is transgender, has a transgender identity, and it's very unlikely to change in the future. The next condition is that the identity has to be present for at least 3 years. And then three paragraphs that are quite strict from 1980 that did not allow for people to be married and otherwise had to divorce in order to change their legal status. They also had to be incapable of reproduction and needed to be sterilized to be able to legally change their name and their gender entry. And it was required that they had to undergo operations on their external sexual characteristics. But there was no minimum age needed for changing the gender entry. Now, as I said before in the previous slide, there is, since October of 2017, the possibility for marriage for all. So that means that there was no longer a need for people that wanted to change their gender entry legally to divorce if they were married. And in 2011, there was also a ruling of the German Federal Constitutional Court, which also abolished the conditions of sterilization and the need for operations in order to change the gender entry. But currently, we have discussions. So to summarize, the current situation is that there's still the need to present a judge, so you still need a court ruling, and you still need to present a judge with 2 expert opinions that certify that an individual is actually really transgender, and this will not change. So these are usually medical professionals or psychotherapists. And also on this topic, or on this current situation, there are a lot of discussions and debates, because the experience of going to 2 different experts is seen as a very discriminating and degrading experience, because a lot of times very intimate details are asked in these interviews, for example, about childhood, about past sexual experiences, about their sexual fantasies, and so on. So these are very, very personal, very intimate details that they are being asked. Also, it costs a large amount of money, so it costs sometimes up to 2,000 euros to have these 2 expert opinions, and it also takes a lot of time to find them, to go there, to have these interviews with them. So it's actually, people say it's a disproportionate amount of time and money. And actually, I think the most compelling argument of all is that the gender identity of a person cannot be assessed externally. So actually, you always have to rely on what the person tells you in order to assess their gender identity. So you can't objectively assess it. It's always what the person themselves is experiencing. And in actually a study from 2015 showed that in over 99% of the cases, the expert opinion is actually congruent with the personal statement of the transgender person. So yes, this is a very compelling argument, in my opinion, against the against this presenting of expert opinions. But of course, on the other hand, this is also there to for example, very young people that would like to change their legal status, to make sure that they don't change their mind later and so on. But yes. So this is currently under discussion because, as you can see, it's a law which dates from the 1980s. A lot of the paragraphs are very outdated. So in the current German government, in the coalition, they decided to abolish, or they want to abolish the transsexual law and want to include a Self-Determination Act. It's supposed to be called Selbstbestimmungsgesetz, so Self-Determination Act. And the idea is that the legal change of the first name and gender entry in the civil documents is supposed to be made possible at the registry office without a court ruling, without these expert opinions. So this has been agreed that there should be this transsexual law should be abolished and that there should be a new Self-Determination Act, but it's currently under negotiation in the German government. But it is agreed upon that it should come into action in November 2025. So here are some changes that are upcoming. Okay, now to the last part of my presentation, what recommendations or conclusions would I would like to draw? They're actually quite short. I think one of the most important take-home messages is that all medical staff should receive at least essential training on how to adopt a practice of humility, also combined with clinical skills and recognition of the diversity of training needs for different members of the healthcare system. And it's also important to introduce early on modules on transgender health and medical education. And even just short modules can help improve and increase the comfort of medical professionals in dealing with transgender medicine. One more thing, which was also mentioned on Friday already, is the standards of care. So these are the international guidelines on the standards of care for the health of transgender people and gender diverse people worldwide. This is a very recent version, the latest version from 2022. Which is done by the World Professional Association for Transgender Health. This is a nonprofit, interdisciplinary educational organization and professional organization that are devoted to transgender health, and their mission is to promote evidence-based care, education, public policy, research, and respect in transgender health. So I think this is a really helpful tool if you are feeling unsure about certain treatment options, certain what the current state-of-the-art treatment guidelines are. This is a really useful tool. Okay, so now I'm almost at the end of my presentation and just want to zoom out a bit before I open the Q&A. On why are we here? So why are we from the psychiatric department here at a CME for sexual medicine, andrology, surgery? We are here as a part of the Hospital Partnerships Program, and what I just want to point out from a very, very broad perspective is that mental health affects actually most of the UN Social Development Goals. It's ingrained in a lot of different contexts, so it's important when it comes to gender equality, which is also the kind of the broader topic of today's talk, but also, for example, responsible consumption and production. It's also part in reducing inequalities, in the topic of hunger. So it's really a topic that's really important in a lot of different fields. What's also important to note is that mental health mental health disorders and physical health have a close relationship, and there is a high comorbidity between people that have mental health disorders and physical disorders, but also people that have physical disorders also having a higher risk for having mental health disorders. So it's always really important to not look at these fields of medicine in silos, but having a transdisciplinary approach. And what's also quite important is that the mental health disorders, common mental health disorders and addiction disorders are responsible for 1/3 of the global disease burden. So why are we here? We are part of the hospital partnerships program from the GIZ, and we have hospital partnerships worldwide. And those in green, you can see, are those with mental health focus. So the hospital partnerships program is not only a mental health focus. There are a lot of different topics, for example, surgical or on infectious diseases, for example, but those in green are those that have a mental health focus. Yes. So we have partnerships in over 70 countries and over 500 hospital partnerships, and over 10% have a focus on mental health. And now just to zoom a bit more again on the German perspective, how do we deal with mental health disorders or mental health conditions? At the center, there's always the patient or their caregiver. And the psychiatrist, so the doctor who specializes in mental health, only is only one part of the team that supports the patient. So the psychiatrist also can involve other medical disciplines to treat comorbidities, but one important role is also of the psychotherapist or clinical psychologists who have regular appointments with the patient, for example, once therapy. And psychiatrists usually follow the patient when it comes to administering medication, so antidepressants, for example, all other medical disciplines. Then there's then there are the mental health nurses that also can either do inpatient care or that are trained in treating mental health patients or psychiatric patients, but they can also work in an outpatient setting, so they can have daycare services for psychiatric patients at home. And one big group involved in the treatment of psychiatric patients are social workers in the community, but also having occupational therapy for the patients. Sometimes also complementary digital mental health, so sometimes some types of apps, for example. And I wanted to conclude my slide on our hospital. It's the Charité in Berlin. It's one of the largest hospitals in Germany, we're just very happy to be here and be part of this partnership. We're here also on the behalf of our department heads, Dr. Damta and Erik Hahn, who have been long-year partners with not only the Hannover Medical University, but also the National Institute of Mental Health. We're really very honored to be able to speak here on their behalf. And I'd like to conclude with just one picture of our department. So this is the hospital that we work in Berlin. Thank you very much.